Good afternoon. I'm Dr. Roger Ho, Associate Professor and Senior Consultant in Psychiatry. I'm working at the National University of Singapore and the National University Health System. Today, I will talk about how to manage stress and regain control in your life. This is very relevant during the COVID-19 pandemic. My talk has three parts. First, I will talk about signs and symptoms of stress. Second, I will talk about widely used. It is not a psychiatric diagnosis. The term of stress has at least two core meanings. First, stress refers to uncomfortable state of mind due to the perception of not being able to cope. Second, stress refers to the consequences of the state of mind, including headache, shakiness, and low mood. In Singapore, workplace-related or occupational stress is quite common. This may cause body sensation and psychological health problems. Half of work absences appear to be associated with stress-related conditions. When a patient complains of stress as a psychiatrist, I would ask them what they mean by that and get them to describe what specific symptoms they're having or what specific problems they're finding it difficult to cope. Exposure to stressful situations is one of the most common human experiences. You may ask, what are the top 10 stressful life events? The top 10 stressful life events include death of a spouse, divorce, marital separations, prison term, death of a close friend, injury, illness, unemployment, and retirement for some people. From psychological theories, stress can be defined as a consecutive process consisting of a stimulus, i.e. the stressor, followed by the activation of a biological setup to respond adequately to the stressor, i.e. the stress response, such as the fight and flight experience. From the viewpoint of information processing, stress is understood as the subjective sense of environmental or internal stimuli as threatening. Now, I would like to talk about the biology behind stress response. When we are stressed, the activation of the sympathetic nervous system is associated with specific physiological effects, both directly and indirectly through the release of a hormone called adrenaline from the adrenal glands. Adrenaline is a stress hormone. The effects of the stress hormone include increased blood pressure, increased heart rate, and dilation of bronchi in our lung. Can we adapt to stress? The answer is yes. After the alarm reaction to stress, we will develop resistance and resilience. If our resistance fails, it will lead to exhaustion. What are the signs of stress? The signs and symptoms of stress fall into three main categories. They are mental, i.e. cognitive and emotional, physical, and behavioral. Mental signs of stress include inability to concentrate, bad temper, feeling moody, nervousness, poor judgment, a general negative outlook, excessive worrying, agitation, tension, and feeling overwhelmed. Physical signs include exhaustion, headache, muscle tension, fatigue, lack of energy, dry mouth, diarrhea, nausea, dizziness, chest pain, and rapid heartbeat. Behavioral signs include eating too much or too little, sleeping too much or too little, withdrawing from others, neglecting jobs and responsibilities, using alcohol, cigarette, and tranquilizer to relax, as well as nervous habits such as nail biting or pacing up and down. You may ask, are anxiety and depression caused by stress? My answer is possible. It usually takes a combination of stressful life events and impair personal resilience to unmask anxiety. Depression is 6 times more common in 6 months after a markedly stressful life event. Stress can make you more prone to develop depression or trigger it off. What are the long-term consequences of stress? Besides depression and anxiety, long-term consequences of stress can cause high blood pressure, heart disease, infection, digestive disorders such as irritable bowel syndromes, diabetes, and chronic headache. The link between stress and heart disease is well established. If stress is intense, raised heart rate, high blood pressure subject the arteries to damage and tensions. As the body heals the damage, arterial wall will form scar and being thickened, which will reduce the supply of blood and oxygen to the heart. As research has shown that high levels of stress are known to exert a negative influence on our immune system, stressed individuals can experience frequent colds and other infections. As today's topic suggests, how do we manage stress and regain control? There are psychological approaches, and I call them 4A. Okay, the first A, number 1, avoid the stressor. Some stressor can be reduced or eliminated by learning to say no to additional responsibility, avoiding controversial topics, limit the time spent with the individual who contribute to stress burden. The second A, alter the stressor. If a stressful situation cannot be avoided, it can be altered through expressing our own feeling instead of internalizing them by talking to another person. It could be a counselor or mental health professional. The third A, adapt to the stressor. If the stressor cannot be changed, our response to it can be adapted by changing our expectation and attitude and adjusting our own standards. Some people are perfectionistic, and perfectionism is a major source of avoidable stress. The fourth A, the last A, is accept the stressor. Some sorts of stress are unavoidable, and in some circumstances, the best option is to see the stressor as an opportunity for personal growth and to concentrate on what we can be controlled by ourselves. What other treatments are available if stress leads to depression and anxiety? Psychiatrists offer 2 main types of treatment. They are psychotherapy and medications. For psychotherapy, the most common form is cognitive behavioral therapy or CBT. The patient needs to see a psychologist every week or every 2 weeks. They talk about their negative thought. The psychologist may ask the person to write down their negative thought in a diary. Then the psychologist will help to gently challenge this negative thought, and the person needs to change this thought on their own. The behavioral part involve relaxation exercise or schedule pleasurable activity to improve their mood and reduce anxiety. The patient needs to see a psychologist for 12 to 16 times. The other approach is mindfulness therapy. Mindfulness advises the person to focus on here and now. This will reduce the distraction from negative thought. Although psychotherapy is free from side effects, it is not easy to find a psychologist in the public healthcare service, as there could be long waiting time. Private psychotherapy service can be expensive. Psychotherapy takes time to work, and patients must be willing to share their problem with the psychologist. The pharmacological treatment is antidepressant such as fluoxetine or Prozac. Antidepressant may take 1 to 2 weeks to start to work. The person needs to take antidepressant on a daily basis. We usually recommend the person to take antidepressant for several months. Antidepressant is indicated for more severe depression. Antidepressant is a safe medication. Common side effects include headache, giddiness, and nausea. Some antidepressants help a person to fall asleep and may cause drowsiness. Besides antidepressant, some people need to take anti-anxiety medicine. Some anti-anxiety medicine can be addictive. As a result, some anti-anxiety medication can only be used if necessary. Is there any herb to treat depression? The answer is yes. The most commonly mentioned herb is St. John's wort. The formal name of St. John's wort is Hypericum perforatum. It is a plant that grows in the wild, has been used for centuries for mental health conditions. St. John's wort is widely used for depression in Europe. St. John's wort may work for mild depressions. St. John's wort is not consistently effective for moderate to severe depression. We do not use St. John's wort to replace conventional antidepressant treatment. In terms of drug interaction, St. John's wort can limit the effectiveness of other prescribed medicines. You may ask, I do not suffer from depression. Do you have herbs that can reduce stress level? The answer is yes. There's a herb called Rhodiola rosea. What is Rhodiola rosea? Rhodiola rosea is known as the golden wood or the Arctic wood. It grows at high altitude in the mountains of the northern Europe, Asia, and North America. Rhodiola rosea have impressive stress-lowering property for physical and mental health. As a result, Rhodiola rosea is also called as adaptogen, a substance of natural plant that is able to increase body resistance to stress. Rhodiola rosea was first used in Russia as a traditional medicine. It has been used for centuries to cope with the cold climate and stressful life. What did the health authorities say about Rhodiola rosea? In 2005, the World Health Organization, or the WHO, recognized Rhodiola rosea as a traditional product to reduce stress and fatigue. Similarly, the European Medical Association, the Herbal Medicinal Product Committee state that Rhodiola rosea is a traditional herbal medicinal product for temporary relief of symptoms of stress such as fatigue and weakness. What is the biological basis to prove Rhodiola rosea works for stress? Now, the brain is the least accessible organ in human. In order to demonstrate the biological basis of Rhodiola rosea, this can only be done in animal studies. One animal study found that Rhodiola rosea increased the level of serotonin in the rat brain. Furthermore, Rhodiola rosea can reduce stress hormones and increase energy metabolism. Was there any research about the effect of Rhodiola rosea on humans? Yes, the effect of Rhodiola rosea was conducted in army officers, students, medical professionals, and athletes in open-label studies. The results were published in Journal of Complementary Medicine and Neuropsychiatric Diseases. Rhodiola rosea was found to reduce fatigue level and burnout, reduction in stress level and body discomfort, and increase in well-being and attention levels. What is the dose of Rhodiola rosea? The dose range can range from 100 to 200 mg. It can be taken twice per day. What are the side effects of Rhodiola rosea? Based on the previous research, there were no serious side effect report. It was concluded that Rhodiola rosea is safe. Is Rhodiola rosea addictive? My answer is no. None of the antidepressants or the herbal treatments are addictive except some of the sleeping pills and anti-anxiety medications. In order to be classified as potential addiction, a medication make the person to take more and more to achieve the same effect. This does not apply to rhodiola rosea. This is the end of my talk. I hope you can regain control of stress. Thank you for your attention.
Thank you, Prof. Ho, for the enlightening talk on the topic of managing stress. Coping with stress, regaining control of your life, these are phrases we tell ourselves in the face of tough times. However, sometimes all we need is just the extra external push to get things back in control again. The herb which Prof. Ho mentioned, Rhodiola rosea, might just fit the bill. Rhodiola rosea is available in the form of a standardized extract under the brand name Vitango. By German standards, it is manufactured with the highest quality. With just 2 tablets a day, one before breakfast and one before lunch, this is non-sedative and non-addictive extract will help you better cope with stress with a peace of mind. Hesitate no further and get Vitango at Watson's, both in stores and online, at a promotional price from tomorrow until the end of the month. This session is brought to you by Watson's and Schreiber Pharma Asia Pacific, from Nature for Health. Thank you.